All right, welcome everyone to ACU and the STAR Center's creating an organizational culture of resilience to manage burnout and stress in health center teams. All right, just real quick here about the Association of Clinicians for the Underserved. I'm sure most of you are familiar with us. Basically, we were started about 25 years ago to make sure that clinicians and other providers in the healthcare sector working for health centers had access to resources that they needed to recruit and retain the workforce that's able to do that work. And along with that, ACU has entered into a national cooperative agreement with the Bureau of Primary Health Care. And so our STAR Center, which is our NTAP, our National Training and Technical Assistance Partner, provides workforce-specific resources and training and technical assistance that are free to all of the health centers and PCAs in the US. And we do that just to make sure that they can recruit and retain the clinicians and other staff that they need to continue providing healthcare to the underserved. And so here's the STAR Center team. And if you have any questions after today and need any resources, please feel free to reach out to any of us or visit our website. And with us today, we have Michelle, and Mariah will be behind the scenes providing technical support. So if anyone wants to, looks like she put her information in the chat. You're welcome to send a chat to her or email her at mblake@clinicians.org if you have any technical issues today. But otherwise, we are here and really happy you're all able to join us and hope you'll be able to take advantage of some of our other resources. Real quick, I'm sure we're all way too familiar with Zoom guidelines. Many of us having worked, spent a lot of time on Zoom working the past couple of years at least. But I really would encourage everyone to be as focused on this session as they can today, because it's going to be really fantastic. With us today, we have Clemson Turagano, who is the CEO of Global Leadership Services. And Clemson has done a tremendous amount of work training leaders in a whole variety of professions from all over the world. He served clients in over 30 nations, including Iraq, Afghanistan, Angola, and Kosovo. He's held numerous management and product development roles. And he's also the serving professor of leadership practice at the Citadel, the Military College of South Carolina. Clemson's very familiar with the challenges of resilience within the medical community. A certified emergency medical responder, he is also a qualified combat medic. Clemson has a long history of service with the US Army. And he's also a member of the Consortium for Humanitarian Service and Education, which premiered healthcare giver psychological trauma in its simulations as early as 2008, where it trains students in various aspects of disaster and humanitarian response. A graduate himself of the Citadel, the Military College of South Carolina, Clemson rose from the South Carolina National Guard to be commissioned as an armor officer. In his combat role, he commanded troops during the Kosovo incursion, along with subsequent peacekeeping and humanitarian operations. And that was just a part of his 24-year career, which included postings as an assistant professor at the U.S. Military Academy at West Point and as a professor at the U.S. Naval War College in Newport, Rhode Island. Clemson holds a master's degree in political science and a master of public administration, as well as a doctorate from the Maxwell School of Citizenship and Public Affairs at Syracuse University. So as you can see, Clemson is eminently qualified, and we are fantastically excited to have him with us today. And so with that, I will stop sharing my screen and let Clemson take over and be far more entertaining.
I don't know about that, Alex. Alex, can you hear me okay?
Absolutely.
Outstanding. So let me bring up just our title slide here. Good afternoon or good morning to wherever you might be. My name is Clemson Turagano, and I have the privilege of working with the STAR Center at ACU. And like Alex said, I'm familiar with some of the resilient challenges that are facing medical professionals today. And when I talk about medical professionals, I'm including doctors, nurses, administrators, staff, the whole gamut of medical professionals that provide care to patients around the United States and around the world. And I actually, Alex, found out about ACU. I didn't know this. I actually found out about it a couple of years ago because I have the privilege of having a daughter-in-law that's a family nurse practitioner that was a member of ACU working with underprivileged populations in Nebraska. And she was sharing with me some of the challenges that she went through in terms of not just coping with COVID, but we're going to talk about some of the underlying challenges that all organizations have as they talk about resilience. So the interesting thing about today is that usually we talk about individual resilience, saying, how can we be more resilient? Well, we're going to, like they say, kick it up a notch today. And we're going to talk about how do you create a culture of resilience within a healthcare organization. And that's a much more difficult topic. So let's talk a little bit about resilience here. And just to throw out one definition, there's a lot of different definitions out here. This is one that's often used in the medical community. And resilience is understood as the individual human capability to cope with crises, losses, or hardships without negative consequences. Some people will say is resilience is how do we prepare ourselves for stress, and then how do we adapt to stress, and then basically move back into some form of normality. Resilience is key. And I'm curious, and I need your help here. And if you would, please get ready because Alex is going to help us out. He's going to do a Mentimeter. He'll walk you through how that works. You've got the Menti code, but I'm curious, what is your favorite resilience tactic? What's your individual favorite resilience tactic? So Alex, do I need to stop sharing so you can bring up the QR code?
Yeah, if you don't mind.
Sure.
There we go. And I will share the Mentimeter screen. And everyone, if you go to menti.com and enter the code that is in the chat there, you can go on your phone or in your web browser on your computer, and you enter the code 54208582. And again, that's just in the chat there. You should see the first Mentimeter question. And so you can type in
Menti.com, right?
Yes, menti.com. And as you go on there, you should be able to see that. There we go. We've got one coming in.
Buddy, that's the
Excellent.
best.
So people are listing out their favorite resilience tactics. Oh, running. I'm a fan of that one. And a spa day. Self-care, talking with a therapist, very important. Chocolate.
Yep, we've got running, driving, breathing. What else you see on there, Alex? We got, wait a minute, there was something in there moving a lot. Boy, this is like watching a video game.
I know, we got a lot of.
This is the best. All right. Social support. Remember that. We're going to come back to that one. Walking, social time. There was one in there I saw just for a moment. There it is. Radical acceptance. I don't know who put that in there, but if you want to say more about that in chat, I would love to hear that. Radical acceptance. Reading a book. This is the best cereal for dinner. It couldn't get any better. All right. Exercise is really important. They found out. So we're not talking about individual resilience today, but as we do our resilience practices, 5 minutes of exercise, and we talk about time confetti during the day. And just using that 5 minutes can basically prepare you for another 2 hours, can really help rejuvenate you for almost another 120 minutes, just with 5 minutes of not so much exercise, but just movement. So taking that break, doing a little movement, walking outside, taking a quick walk around your office, or if you're like me and you work from your home, you walk around the house. I happen to live in a forest, which is nice, so I can walk down a couple of paths. But I know if I just take 5 or 10 minutes, it really gets me going for the next hour or two. So we see a lot of excellent tactics that people have, and I encourage you, if you've got a camera, you might want to take a picture of this. This is some great data. And it's interesting, on my screen, I've got cooking, which is right next to chocolate. Very important, okay? Laughing, biking, read, paid time off, all of these are terrific individual resilience tactics. But here's the harder question. And Alex, are we ready for that harder question?
Absolutely.
And that harder question is, does your organization support this behavior? Does your organization do something proactively to support your resilience? And so go ahead and vote if you would. That should be the next question in your Menti code. And this is terrific what I'm seeing right now. Looks like we've got about 16 responses coming in. Yeah. Oh yeah, terrific. 30 responses coming in. Got time for a couple more. Does your organization support your behavior? And I know we had chocolate on there. We might not talk about giving out free chocolate, or they might, but it may be, does it give you time to be resilient? Does it support exercise? Does it support breaks between Zoom calls? I work with a number of organizations that now are making 10 minutes mandatory between Zoom calls, doing as much as they can. And it is expected across the organization. And that expectation has created and raised resilience levels across the organization. So we got about 42 responses here, Alex, and I'm thrilled to see that a lot of organizations are supporting that resilience tactic, because that's what we're talking about today, is how can you, within your organization, whether you're a physician, a nurse, a staff, administrator, how can you create the same type of environment to get answers just like this? And you can go out and ask your organization these questions to see if they are feeling supported within the organization. So thank you very much for starting with a couple of ideas about your personal resilience and whether or not that's supported across your organization. I asked for a quick update on the radical acceptance, which I just found fascinating. And I hope I pronounce your name right. Jelaine writes, radical acceptance is Marshall Lenehan's DBT strategy. Fully accepting something as it is. Okay, very, believe it or not, very much in line with Stoic philosophy. Things are what they are. How you react to them is a choice that you make, and that is within your control. And it allows us to move forward instead of focusing on what we can't change. We reduce our suffering and can focus on what is next. Hey, Jelaine, thank you very much for that explanation. I certainly appreciate it. And I think that radical acceptance is really important, because as we walk through our conversation today, we're going to be talking about those things that you can possibly change within your organization. And Alex, you should be seeing a slide right now that says, what is your favorite resilience tactic? Is that correct? I just want to make sure my slides are shown. Thank you very much. We talked about whether or not organizations support, because when they don't, this happens. So the opposite side of resilience is what the World Health Organization has recognized as burnout. The human response to chronic emotional and interpersonal stress at work caused by exhaustion. Basically, I'm overwhelmed. Cynicism, that's that radical acceptance. I can't do this anymore. I can't take this anymore. I can't do anything about it. And inefficacy, I am not making a difference. Those are the three main causes. And when we look at medical studies, such as the Maslach burnout inventory, emotional exhaustion, depersonalization, that's a real key. And they're finding that that is actually a dominant variable in burnout, is depersonalization. I don't make a difference. When that happens and you start losing the efficacy of your impact, burnout really takes, it really increases in an exponential way. And that recreates that sense of low personal accomplishment. So what can we do as leaders within organizations? So like when I retired from the military. I joined the Center for Creative Leadership. I've been working with them for over 15 years. Now I have my own organization. I still work closely with the center. So I focus a lot on leadership in organizations. And I see everyone who's on our call today as a leader, because one thing we know about leaders is they want to get better and they want to learn how to help others. And so we're going to talk about 4 key areas in our time together today. We're going to talk about why this is important. We're going to go over some more data to demonstrate why organizations need to create cultures of resilience. I say cultures of resilience as opposed to resilient cultures. Cultures of resilience means that we're going to create a culture within which you can do radical acceptance. You can do running and you'll have time to do it. You're going to have somewhere inside your organization where you might go to practice a resilience practice, to practice mindfulness, to be alone, to talk with someone within your organization. That's a culture of resilience. And we're going to talk about 5 steps that you can do to create this, what organizational leaders need to do, what they need to do, and how they need to do it. We're also going to talk about what it might sound like when it's successful. And then we're going to have an open mic we're going to use chat, and we're going to get some thoughts from you about what you can do within your organization to create that culture of resilience. So let's talk about why this is important. And this is based on a study from the National Mental Health Agency. And at the end, I'll provide a bibliography. I've got a whole bunch of links for you if you want to look at this study. This study was done last year about the impact of COVID-19 on mental health and general healthcare workers. And what they found out is that the percentage of healthcare workers experiencing stress, anxiety, frustration, burnout. So you can look at those numbers and see the impact on patient care, the impact on the quality of delivery of service, and the impact on basically the organizational culture of healthcare providing organizations. And then they asked them, and this was in September of last year, they said, what are some changes that you've experienced over the last 3 months? And they found out these were some of the changes, and these were the percentages of people that reflected those changes. And I think we have a Menti where we could do the same questions for our group here today. Is that right, Alex? And Alex, you might be muted.
Yes. Yeah, sorry, I was pulling up the Menti screen before I unmuted myself, just getting ahead of myself.
No worries. Let me stop sharing. We'll bring up that Menti screen.
Yeah, we had the from whom do you receive support question. It looked like folks were already answering that one. So that's great. We got all the responses in there already.
Yep.
And then the next one was, what are your stressors over the last 3 months? So we'll give folks a time time to answer that.
Because this is, as we look at these figures, the reason these figures are so critical is they reflect the challenges that our healthcare workers are facing and why having a culture of resilience is so critical. Yeah, what are your top stressors over the last 3 months? Lack of communication, workflow changes. It's interesting that as basically many healthcare organizations for the last 2 years have been in a crisis situation. It's a crisis mode with crisis planning and crisis reaction. We've all been running on adrenaline or some form of adrenaline for the last 2 years. And there's going to be now a post-adrenaline letdown. And also there's going to be almost a reflection and a refocusing on what does normal look like now? What can we afford to go back to normal, or will there be another strain? How do we prepare for that and go back to our normal healthcare practices? Workload, work, staffing, finances, and thank you very much whoever put exhaustion in there. Very powerful. People are uncooperative. it's interesting that my experience with a great deal of stress comes from being in a number of different combat situations. And, you know, your adrenaline is up, your stress is up, you are very, very present. And then all of a sudden you come back to a situation where that's not necessary. And you almost become addicted to that adrenaline flow. You become addicted to that type of pace. And you actually need to be retrained, and you need to refocus on how to accept the new environment. All of that comes under resilience. All of that an organization needs to support. And that's why the question of how is your organization supporting you in your resilience? So if you'd like to take a look at this, and Alex, could you go back to the family one? I think it was the one before this one. Yeah. Here's one that is really interesting, because we're going to show some thoughts about who is supporting our healthcare workers. And it's great to see that we've got family, we've got friends that are supporting, we got spouses, but this is great. First of all, I want to thank everybody who attended our talk today, because I think you're going to see some very similar figures when we talk about this. Same level workers. That's something an organization can have an impact on. The supervisor. That's something that the organization can have an impact on. Is if we talk about building communities of resilience, and we talk about how we can help others be more resilient, and supervisors can role model resilience, then we can start using them for more support, and they become more empathetic, and they accept someone's resilience challenges. And we're going to see this other piece. I'm really glad that we are using trained people who help us out to help us become more resilient. But the fascinating thing about these figures is we're about to show the results of the survey that the National Mental Health Association did. They're very similar. Is we really depend on our family, okay, and people who are closest to us. But in terms of the organization, not so much. But that is something that organizations can focus on. That is something that an organization can change. So I'm going to go into that right now. So pardon me, change my slide real fast. There we go. And here's the research I was talking about. Is first, 69% of nurses feel like they have inadequate emotional support. And primarily at work. They have emotional support in their family, and that's what we see here. Where do you receive emotional support? Take a look at that and think about the answers that we just saw for our Menti survey. There we go. There we are. When we look at same level of coworkers, remember peers, 38%. Supervisor, 15%. And then, yeah, there's always this one. There's the whole no one. That's really scary. And that's somewhere that organizations can make a difference to help people see that seeking help is not a sign of weakness. Seeking help is a sign of courage. Being vulnerable as a leader and also being vulnerable with the people you lead is a sign of courage and also excellent leadership. Right now, the figure that concerns me the most on this page is the fact that it says 12% of the people who surveyed probably are not seeking any help at all. And yeah, thank you very much. And thank you, Caitlin, for putting that in the chat. Caitlin writes, the availability of mental health professionals is super low right now. Yeah, they are really in demand. And do we always need a mental health professional? Sometimes we do. And how can an organization help create an environment where everybody is helping everybody else to reduce the load on our mental health professionals? And Kate says it well, and they are probably getting burned out as well. Sure they are. So how can we create an environment where we have other people to talk to? And when you look at how we might be able, sorry. When we look at those stressors that we asked you to look at, and we saw workload, process, et cetera, if we look at just the stressors that were identified in the survey, you can identify certain areas that organizations can play a role with. And those, some of the ones that organizations could mitigate some of that stress, uncertainty about when to return to normal. One thing that organizations control is time. So if we talk about at this time, we're going to do these things, and you can look forward to this, and that comes true, it mitigates some of that stress. Burnout. If we start seeing people burn out, we can help them sooner. Increased workload. You talked about that on your Menti poll. All right, that is something that organizations need to address. We're going to talk about that. Insufficient PPE goes without saying. Working too many hours, job security, insufficient training. Every one of these is an organizational issue. Every one of these plays a role in creating communities of resilience. My favorite, inappropriate role designation. One of the people I talked to prior to, as I was putting together information for this conversation, was a friend of mine who is a cardiovascular surgeon who they brought up to the COVID ward. He also was he worked in emergency rooms for about 10 years, and they went into the cardiovascular practice. They didn't need people doing that. They needed him in the COVID ward. And he was always wondering what he should be doing and what was his responsibility. We'll talk about the impact that has on people. And then, of course, working at a new location. These are all things an organization can focus on. So the challenge that faces us when it comes to resilience is basically in three different levels that impacts a healthcare professional. Healthcare professional, again, including physicians, nurses, staff, administrators, all of it. Three key things, all within an environment of COVID. And getting back to something Caitlin said earlier, radical acceptance, we can't control COVID. So, it's there. It serves as an accelerant, but the three areas that contribute to a lack of resilience for healthcare professionals are, first is the myth of the superhero. Is I've got to do everything. I'm the superhero nurse. I can't take breaks. I can't go see my family because I have to be the superhero. The health business needs. We have to follow policy. We have to make sure that we have an ongoing enterprise. We have to follow CDC restrictions. We have to follow business restrictions, and that becomes extremely stressing as we encounter COVID issues. And then there's the specialty discipline piece. And the specialty discipline piece is something that begins when we go through our technical specialty in the academic side of doctors have to do this. Nurses, if you don't do this as a nurse, you're not going to be successful. You're not going to be a good nurse. If you don't do this as an administrator, you're not taking care of the organization. You're not taking care of the staff. That's what we call specialty discipline. And although it's a positive, it helps us get through school, it becomes a negative because that's our mindset when we go back into the medical community, that only doctors can do certain things, only nurses can do certain things. And some of it is legal, some of it's medical procedure, and that's accepted. But when it comes to a point where the only becomes the way that your mindset sets both your leadership and your interaction with others, that creates stress. Combine that with the superhero mentality, combine that inside a business context that is also under stress within a COVID environment, you've got a huge resilience challenge. So what do leaders need to do? 5 things. So in keeping with working with the medical community, I need you to open wide and say, all right, 5 A's. Need to acknowledge a real problem, and it's not COVID-19. COVID-19 is an accelerant. There's 3 other challenges we need to face. We need to accept the need to do something about resilience in the organization and why. We've already seen why, the figures we saw, as well as the Menti polls that you took. We need organizations of resilience. We've got to adapt and change, but more important, accept people as they transition, act as role models, and allow the organization to transition. I'm going to talk about these 5 A's very quickly. Acknowledge the problem, accept that we need to do something. Acknowledging and accepting it are 2 different things. 2 different things, 2 different parts of the brain, 2 different thought processes. Adapt. Know that we have to change, and change is management, transition is leadership. We've got to act as role models and then allow the organization to transition. So when we talk about acknowledging the real problem, COVID is what it is. And I just got to go back to radical acceptance. Absolutely. We can do some things about COVID. We can do, basically a lot of protocols to protect ourselves. That's about it. The real problem has to do with that superhero mentality, the functional discipline, and especially discipline, and the health business needs. Because the myth of the superhero gets people working really hard, but sometimes not real smart because we overdo it. The business side, you'll start to see it because you acknowledge it, because policy becomes an excuse, not a solution. You've got to do it this way because we've always done it this way, and we're going to do it this way going forward in spite of whatever. Real challenge. You run into a lot of teamwork issues and poor engagement scores. People aren't working together. And also when we talk about teamwork issues, that's where we fall into the specialty discipline. I'm the fill in the blank. I'm the administrator, and it has to be like this. I am the doctor, it has to be like this. I am the nurse, and you do what I say. I'm the staffer, and this is, I'll decide when this gets cleaned. Oh yeah, that's that specialty discipline going over to the business side and being reinforced by that superhero mentality. Acknowledging that this is the key area we want to address in terms of resilience, and these are key stressors for us going forward. The second A is accept. And we want to accept the need to do something and why. We've seen some of the why before. And that myth of the superhero, you can only go so far. All of you as health professionals are the Maseratis of your function. And the problem is even Maseratis run out of gas. And so you've got to stop, you got to slow down in order to speed up. And that myth of the superhero gets in the way of that slowing down to speed up, creates cultures of failure, and that I can't be like Alex and Mariah and Susan, who are fantastic superheroes. I can't do 23 hours of work all the time. I must be a failure. That becomes reinforced. People get inside their own head. You run into resilience challenges, and also you run into depression challenges. There are short-term positives to superheroes. You can get through a short-term issue, but long-term, oh yeah, they're going to crash. When we talk about health business things, you've got your standard business issues. You got operating revenue deficiencies because people are not following policy, so that they're using more of their time, using more techniques, may or may not be helping patients. You get poor administrative discipline, and that's where those low-tier engagement scores come in, employee engagement scores. And then finally, that specialty discipline one is really, really tough when we accept the need to do something and why, because that specialization, that needing to know it all, may not come into question, but it may come into a different environment of how can we leverage this in a more positive way. We start talking about accuracy of diagnosis because someone's a superhero, they've been up too long, they're trying to follow the policy, and they may not come up with the right diagnosis. Quality of service hurts, and then you have retention issues. So acknowledging and accepting it are 2 different things. You might want to get your camera out, or we'll be, I think we can provide these slides, Alex, to do.
Yeah, we'll share slides and the mentee answers.
Yeah, I mean, let's find out what to do. Engagement surveys, revenue reviews, something I have the privilege of working with a number of banks. And as they start looking at processes, they have what they call accountability audits. And let's go into who is accountable for a certain process in a positive way. It sounds meaner than it is. I've been through a couple of these, and they actually, I don't want to say they're fun, but they're fairly lighthearted. And it's, okay, who needs to do this? What are we doing? Why are we doing it? How can we do it better? Accountability audits. You want to have level appropriate culture forums. And this is one of those things where you might have the 4 different areas, nurses, doctors, staff, admin, come together and talk about what we might be able to do to make the culture better. That's how we start accepting the need and changing it. Key is department heads, and we'll talk more about that, and then integrate that resilience into the organizational strategy. Your first Menti poll says that's happening in some organizations right now. You might want to share some ideas with each other about how that's going on. If someone has an organization that has a resilience strategy integrated into it, and you feel very positive about that, we'd love to have you put that into chat if you feel comfortable sharing that with everybody who's on our call today. So we've acknowledged it, we've accepted it. Now we have to change it. And this is something that is really powerful when you talk about change and transition. Change is all about management. It's visible, it's situational, and physical. We can see it, we can measure it, we can do it. That's all management stuff. And we've all seen it. Hey, you're going to get a new boss. And how many of us go, great? Actually, a lot of us go, wonder what that means to me. That's the transition. And William Bridges has a wonderful work called Managing Transition. This is the book. And strongly encourage everybody to read this, because this is how people embrace change, is they transition into it. It's a process, it's psychological, and it's invisible. This is why changes fail in organizations, is they don't take time to transition. And this is the transition piece. That's what you see in the hallways. That's what you hear in the break rooms. That's what you feel in the meetings. So if somebody comes down and says, hey, I got this new process that's coming out, it's going to be great. Everybody's like, that's the first start of transition. They're thinking about it, but maybe not in the most positive way. And they might have to go through a number of stages that we're going to talk about. When we change, it starts with that whole phrase, come on, we're going to improve resilience. It's going to be great. But you know, people are transitioning, and they are accepting that they're not going to be the superhero, not going to get overwhelmed with business practice, not going to be caught in that specialty discipline. When you hear language like, wait a minute, I hear that, and that's great. We're following the resilience process. And for that, I'm not pulling an extra shift this week because I need some time at home. Outstanding. You hit the ball out of the park. It was, it was basically UConn in the net in the last 2 seconds yesterday. You are really making resilience happen in your organization because you're practicing change leadership in addition to change management. You must have both. So you got to make time for that transition. What does that look like? So these are 3 actual resilience programs in different organizations. And this first one, I've asked my friends at a kiwi fruit company that I have the privilege of working with. I don't know why my pointer's not working. I apologize. There we go. And theirs is called Boost. They have 5 basic practices: take notice, keep learning, connect, give, and be active. But it's interesting that their CEO and all of their executives will walk around the halls and talk to the people within the organization and ask, how did you boost today? What are you doing to boost yourself? How are you remaining charged throughout the day? A big thing in this organization is walk and talks, is, hey, we could do this on Zoom, or, we could send emails, or you just walk down to the cubicle, hey, let's take a 15-minute walk and walk around the building. And, they are privileged to be in New Zealand, so just walking around the building is a beautiful thing. And so what they ask, and the question they ask each other is, what's your healthy way of doing something? And it doesn't mean an hour at the gym. It can mean a 10-minute walk around the building. It can mean, using the stairs instead of the elevator. It can mean addressing your diet, or most important, making sure you get enough sleep. But they ask each other, what's your healthy? The second, the second resilience practice that we have comes from the Center for Creative Leadership, and it's called Burn Bright. And it is entirely focused on people not burning out. And they have a number of short, quick resilience practices in physical, mental, spiritual, emotional, and social. The important thing is that with organizations that we've worked with, an organization I'm working with right now, They have integrated Burn Bright into each of their meetings. And one of the things that they've done in focusing on the social side is whenever they go into a meeting, it's going to be a little tension, is they talk about and go, hey, give me something positive that happened in your life in the last 2 days, something positive. And in that way, starting off from a positive perspective, positive energy into the meeting. The other thing that they do is when they conduct a after action review or they do a post event briefing, instead of going in and saying, what did we do wrong? They start with, what did we do right? What did we do right today? Well, we tried something new. We came together as a team. We worked together. Awesome. And what that does is that starts with a positive intent for the activity. That's a part of resilience. And you start to see that people across the organization are motivated to do new things, and innovation increases. The other thing that this organization did that we're working with is they created resiliency spaces in their clinics and offices. In addition to facilities for new mothers, there is also facilities for mindfulness. There's facilities where you can go and just speak with people quietly. They actually built new pathways around their offices where people can walk and talk. And they reinforced this from the CEO on down, reinforced this saying, this is what it's for. You'll see me out there. And they role modeled that resilience. The final one I wanted to show you here is actually part of an academic study that was done in Bergamo, Italy, called the R² study. And they wanted to put this resilience structure to work with one of the highest impacted COVID-19 areas in Italy. And they found out that the impact on the healthcare professionals that participated in this resilience program was exponential. And positive outcomes in every area they studied, which is each of those variables that are in those two boxes. You might not be able to see that real well, but the reason they call it R² is it was both inside, and that was the rugged piece, inside of you. How do you practice gratitude, self-confidence, optimism, etc.? And the environment, that was resource. So how did we change structure to help you? How did we increase accountability? How did we reinforce those supported relationships within the organization to help you do those rugged things? And what they found out were exponential increases in the quality of life, mental health, physical health, and relationships. Why? Because those people felt franchised. They really felt empowered, and the entire organization was doing it as one. That contributed to the success for these healthcare workers in Italy. The link to that study is in the bibliography. You can check that out and see how you might be able to do that in your organization. One thing that we found with every one of these organizations was you have to allow the organization to transition, and that takes time. And as we look at the organization transitioning, they go through, it's interesting that there are 3 phases to transition. There's Kubler-Ross's basically stages of grief: denial, resistance, exploration, commitment. Something is ending. Our adrenaline drive that we've been in for 2 years with COVID-19 is waning. That's ending. And some of us, hey, that's how we got things done. I survive in a crisis environment. I don't want that to end. So there's denial. But that transition piece has to do with ending. Then there's the neutral zone, which encompasses the valley of chaos, or the neutral zone. But then there's the new beginning. Beginning a organizational resilience practice is a new beginning. And it's how we might move out of that adrenaline-packed COVID-19 environment towards something that is more positive, and towards something that is, most important, sustainable, and being sustainable over time. And here's a couple of things you might want to do is, first, talk about what we talked about today. Communicate the need. We need to have a community of resilience. Do what many of the executives and senior leaders did in those organizations I described, and that is model the transition. In one organization, I was there yesterday, and he said, I said, hey, we're going to have this meeting. And he goes, oh, let's do a walk and talk. It's just 3 of us. And I'm like, really? And yes, and we went out and we walked around in the woods and we did a walk and talk. Sorry about that. Enlist change agents. So as you do those level appropriate forums to talk about the organization, find out who is very energized about this and you might be able to use as peer change agents. Remember, we had in that one in that one survey, it said, you know, do we talk to other people who are our peers? That's where that comes into play. That's where you begin to build the trust and the resilience, because someone you know trusts the process. That way, someone who doesn't may not know it or trust it rises to the occasion and starts coming out of that valley of chaos. We talked about vulnerability. For those of us on the staff and the admin side, yeah, we want to track engagement scores. We want to see, as we integrate this, how is this improving engagement, teamwork, leadership, and people's basically how they feel about coming to work. Reward those who explore early. I've got to smile because my friends in New Zealand, they have a number of Boost awards, and they're fun awards, and they started making a big deal out of those people who really found they're healthy and made significant life choices or significant choices within that policy. Understand there's a lot of people who are going to be in the valley of chaos, and it's going to take them some time to start exploring and become committed to the new resilience practice. They may not like the mindfulness things. They may not like the alone rooms. The organization I was with yesterday has 2 nap rooms, and they are serious about the nap rooms. And they found out that initially a lot of people, they were in the valley of chaos about the nap rooms. Now they have to have a sign up online for the people who come in, and you can only use the room for 20 minutes because the napping piece, 10 to 15 minutes is good before it starts interrupting your sleep pattern. So you can only reserve it for 20 minutes. And I walked by it yesterday. It was booked solid from about 10 in the morning to 3 in the afternoon. People really take that seriously, and they found out it boosts productivity. The final thing is don't give up. What we've seen today is that just this group today has organizations that are supporting them. And if there is a way that you might be able to leverage that and continue that support, you're helping other people. You're helping all those people who say, 90% I'm overworked, I don't have anyone to talk to, I don't know where to go. Moving forward in any way addresses those types of challenges. Also, it brings those ideas of, you know, superheroes are nice to have, but all superheroes have shadows. Business, basically business compliance to the nth degree, it may create efficiency, but your effectiveness is going to fall down. And your technical specialty is meant to work with others in a healthcare team for the good of the patient. How can we leverage that to have even better patient care? So those are our 5 key things that organizations can do to become more resilient. Acknowledge the real problem. Don't blame it on COVID, okay? We can't do anything about COVID. Accept the need to do something about resilience in the organization and why. Take a look at the data that I presented. There's plenty of data out there. I'll bet you in your organization, you already have data about the challenges people are facing because of it. Adapt and transition, act as role models. Find a program that's out there, but most important, get the leaders, both formal and informal leaders, out practicing resilience techniques and talking about them as being important for the organization. And I know this is the hardest thing for all of us, because one of the reasons we're where we are is we solve problems, and we solve problems quickly. This is not really a problem. This is a dilemma. This is a dilemma between rest and activity. And if we manage this dilemma effectively, people will know when I'm at work, I'm the superhero, but I can only be the superhero for this shift. And then I've got to go rest so I can be the superhero again. And in managing that dilemma and understanding that polarity, you can have a more effective community of resilience. So wanted to give you those 5 things, wanted to give you some ideas. We've talked about what you might be able to do and how you might be able to do it. I'm curious for your ideas. So we're going to use the chat function. And what is one thing, we've talked about a number of things. I'm curious what ideas this might have stoked in your mind. What is one thing you might be able to do to help your organization become more resilient? And I think, and Alex, do we have a word cloud for this one?
No, we don't. We'll just have people put this in the chat, and the chat will be visible on the webinar recording, I believe.
Brilliant. Yeah, Amy, thank you very much. Become a role model. Yeah. The interesting thing about medical professionals is you're a role model to so many other people. You're a role model to your team, you're a role model to your organization, and you're a role model to your patients. So as you're talking with your patients in a, in a healthcare protocol, you can be saying, are you doing these things? I do it and it helps me out. You have a voice of authority. And Katie, I hope I pronounce your name properly, Katie Hahn, set and maintain personal boundaries inside and outside the organization. And I'd only add one more thing, and that is let others know what they are. Let others know what they are. I have the privilege of working internationally, and my international colleagues know I don't answer the phone after certain times at night. And they're wonderful about that. They know I'll get back to them first thing in the morning. Be a role model. Start making the conversation with the positive before getting and setting the tone. Lori, I think you're spot on. And it's interesting because people will go, oh, let's check in. And that's great. You can check in. And how about checking in with a specific question? So, hey, we know we've got to talk about stuff, but I'm really curious. Let's take about 5 or 10 minutes. What's something really good that happened to you in the last 2 weeks? All of a sudden, everybody starts on a positive tone, and we see each other in a more human perspective, and not just because of our position or because our official title. Set a positive example. Rachel, I'm telling you, build a nap room. It became one of the most positive places we had. Create and stick to your boundaries. Premier, set organizational mindset and create a shared language around supporting resiliency. Yeah, that shared language piece and that training can be really helpful. And it's interesting that just CCL's Burn Bright stuff, I like it because all of it is done in 10 to 15 minute chunks. I mean, it's not a 2-day long thing. You can learn the Burn Bright techniques and why they do it in the research. 15-minute chunk about social, physical, inspirational. And, that inspirational piece goes beyond what inspires you. It's what's your why? Why are you doing this? And I know that working with healthcare professionals, a lot of us have a very easy answer for that. It's funny when you work with manufacturing people and you talk about what's their why and why they might be working so hard and why they might not want to let go of that superhero mentality. But that inspiration piece for preventing burnout becomes really, really important. Make a point to reach out to peers. Yeah, absolutely. Regularly listen. Get rid of the clutter. Thank you. Thank you so much. Yeah, I'll tell you what, you focus on the priorities and the resiliency will happen. I love that extend grace and compassion to yourself and your coworkers. You don't know what other people are going through. And if we accept that and you use that as a starting point for conversations, you're going to be doing great. Have engagement conversations and build resiliency programming into the cost of doing business. Katie, thank you. Yeah, it was interesting when I was in the Army, when we started doing a lot around resiliency and mental health. And as an old Army officer and an old Army soldier, I didn't want any piece of it because I was a superhero. And then I was lucky to have some great family support and peer support, and said that, Clemson, you're not a superhero. Okay, you're a hero, you're a great guy. And you probably want to take advantage of some of these things, and you will have a better life experience. You will have a better quality of life. I took their advice and I do because of their intervention. That was worked into the Army budget. And now there's a number of things that you can do within the government to make sure you're more resilient. Create practices on how to respond when you see a behavior that does not support resiliency. Boy, that's the hardest one. And that's a whole nother conversation we might want to have another time, is how do you don't need a whole intervention, but how do you provide feedback in a way that will lower someone's defenses, that's based on data in a way that they accept it. And Jenny, thank you very much. Resist bullying when frustrated. And I know we have about 5 minutes left. I want to thank you very much for your time today, your insight, your fantastic ideas, and just keep these 5 things in mind. Acknowledge the real problem. Know that everybody's got, and I was talking to an administrator, he goes, oh, you know, those nurses, they're superheroes. And those doctors, I go, yeah, you're also a superhero. You are also a technical specialist. You are all, and it's like, yeah, I guess you're right. It goes across the whole healthcare community. So acknowledge the real problem, accept the need to do something, adapt, act, and then work with everybody, allow the organization to transition. I know we've got about 3 minutes left. I want to thank you for your time today. I feel honored to share this information with you. I feel honored to be with you today. And if no one else thanks you for what you've done over the last 2 years, I want to thank you because science rocks. Healthcare professionals are the heroes of what we've been able to do over the last 2 years, and I'm indebted to you. So I'm going to stay on for about 5 to 10 minutes. I'm willing to take any questions that you have. Alex, Mariah can help us out with the questions. And thank you very much for all you do. I hope I have the opportunity to talk with you again. Alex, back to you.
All right. Thank you very much, Clemson. And yeah, so Mariah, thank you for the reminder. We've got the eval poll. Our evaluation should be popping up on your screen real quick before you leave. If you can fill that out for us, that helps us be able to continue doing our job. And yeah, thank you everyone for attending. Like Clemson said, stick around for a few minutes if you can. We're happy to take questions. You can type them into the chat. And Clemson has generously said that he'll stick around for a while in case anyone has any specifics that they'd like to ask him.
And we got a question about the book that I showed earlier. It's called Managing Transition by William Bridges. Managing Transitions by William Bridges.
Excellent. And let's
Sarah,
see.
I'm looking
do you
at
see your question?
Yeah, are there different strategies folks can utilize to help facilitate resiliency culture within an organization when you are not in a leadership role? Yes, absolutely. You know, it's interesting because that is how resiliency got started in the organization in New Zealand I was working with. They started with a small group of people that said, we are, you know, basically we're in a very high stress environment. We need to start being more resilient. We're going to start these practices. And many of them go along the lines of what has already been put out. You know, we're going to have rules about when we're available. We're going to have rules about how we interact with each other. We are going to hold each other accountable for this. And it was interesting, the CEO, who is a very, very proactive guy, he started looking at it, and the chief of human resources, they got together and said, we need to do this for the whole organization. And that's where Boost came from. So there is a lot you can do by starting to do it and letting other people know what you're doing. That is so important. You know, one of my bosses would come out and he'd say, I love you. Don't call me after 8 at night unless the building's on fire. Now, if the building's on fire, I expect you to call me. But after 8 at night, that's my family time. And unless it is an absolute emergency that might involve someone's death or you or I getting fired in the morning, don't call me. And I remember one time I did call him. It was on a client issue and it was after 8 o'clock. And he's like, he says, well, do you know what I'm doing right now? He says, I'm sitting on my back porch. I'm looking out over the Pacific Ocean. The sun's going down. And, you know, you really didn't need to call me on this. We can do this in the morning. Best boss I ever had. Terrific boss. So setting those rules and then letting other people know why they're important is one thing that you can do, even though you might not be in a leadership position. Oh, tips for remote teams. You know, how many times have I said the rules piece? Tips for remote teams, do whatever you can to get to know everybody, but not everybody wants to have a quarantini every Friday afternoon. So if you could do that every now and then and do something that some teams have done, there are organizations that will send the same snack to every member of the team. And then when you have a meeting, everybody's sitting there eating the same snacks, drinking the same drinks. That's a way to replicate the team working together. Also, remote teams usually work as I do in different time zones, and showing a lot of grace about time zones and rules about when you'll talk to each other and how you'll talk to each other is also really critical. Oh, wow. Can you talk about the intersection overlap between trauma-informed care and boy, I'll tell you, I wish I could. And in all honesty, that's probably outside of my box. But my guess is that I hope I say your name right, Aniela, which is a beautiful name. Aniela, if you and I had a conversation, you could probably tell me more about it. But that right there, that idea of trauma-informed care, you know, that's at the core of resilience. And it's also very important, not only for the person with trauma, the person that is sharing their trauma with others, especially if they're talking with them. And that's where I would guess where the intersection of 5As would come in. And let's see if there's any more remote. Not in a leadership role. All right. Oh, thank you very much. Andrea put in a great website, trauma-informed, looks like regon.org, amazing website. Yeah, that's great. Let's take a look at that. I'm going to take a look at that after this. Just a second, I got to copy that. No, thanks, Alex. Yep, absolutely. I'll tell you what, the telehealth thing is just, well, I don't have to tell this crowd this, that's just amazing how that all works now, and what you are able to accomplish. Of course, the challenge is the other person you're speaking with has to have a little bit of technical competency, but if you're like me and you have wonderful people like Alex and Michelle and Mariah to help you out, you know, telehealth's like this webinar, it's going to work out seamlessly. And I'm finding out actually that, you know, there's some providers that are teaming up with what we call in our world producers. And the producer will help get the other person online. We'll talk them through all the technical functions. And that way the technical function basically becomes not important to the healthcare provision. So that's just another way that you can do telehealth. Great point. Alex, what are we leaving out? I'm gonna go ahead and stop sharing here.
I think the only thing that I would think to add is that remote worker piece. One of the most challenging things with that is recognizing that you can still take away someone's space, even if they're working from home. So it just goes back to what you said, like leave space between Zoom meetings, that you can get Zoom fatigue. And same thing with telehealth workers. Remember that even if they're working remote, you can't stack patients back to back to back with no break, because at the very least, they got to go to the bathroom at some point.
Yeah, if you have Microsoft Outlook, believe it or not, within Microsoft Outlook Calendar, there is a way to set up your appointments so that you have time between appointments now. And that's an app that I'm using now pretty effectively, actually, because I'll get a little reminder going, your time is up. And that's a fun thing to say to people going, hey, our time's up, gotta go.
Absolutely. And if you don't mind, real quickly for the folks still on, I'm just going to share this 1 second, and this will go out with the slides. Oops. But we do have our workforce symposium coming up in May. So I just wanted to get the word out there for anyone that's interested. And again, you can go to our website, chcworkforce.org, or you can follow the link that will be in the PowerPoint slides that'll go out as a PDF to everyone. If anyone is able to attend, we would love to see folks, anyone that's able to make it there in person. All right, I just need to get that pitch in, you know.
Absolutely, absolutely.
But yeah, otherwise, I think, yeah, thank you so much, Clemson. And Man, and thanks to everyone who stuck around.
Thank you, everybody. That was so much fun. That was easy for me. Thank you for making it so easy. And Alex, thanks to you, Mariah, Michelle, and Suzanne for your support for this. And hope we might be able to do this again sometime.
Yeah, absolutely. We really appreciate your time. All right. And I think we will let everyone go. Thank you again, Clemson. Really appreciate it.
Everybody have a wonderful rest of your day, and go out and do a resilience practice and tell everybody you're doing it. Thanks again, everybody. Hope to see you next time.
Thank you.